Good afternoon and welcome to another edition of the Texas Public Policy Foundation Monday live stream. That's a long-winded way of saying that every week here for 1 hour, Mondays at high noon, we talk about the pressing issues of the day. And the pressing issue today is that we would all like to take this pandemic seriously, Chuck DeVore, but we're having a hard time figuring out what we should do as individuals because the data is so doggone terrible. So what we're going to do today is, in good think tank fashion, although it's going to be as exciting as we can make it, is talk to two experts who really have been in the front lines of analyzing the data, assisting not only those of us at the foundation, but elected officials in analyzing that data and proposing clearer ways that we can communicate the extent of this crisis, both the health crisis and the government response crisis, in a way that we as individuals can make virtuous decisions. It's in fact what we trust one another to do. So it is a great privilege every day to work with Chuck DeVore, my longtime colleague, who for a while was a member of the California Assembly and then came to his senses and moved to Texas, where he has been a member of our senior staff here at the foundation for several years. So Chuck, thanks for joining us today.
My pleasure.
And of course, we are joined by one of our new good friends, Carlos Carvalho, who is a professor of statistics in the University of Texas McCombs School of Business. He holds a Ph.D. in statistics from Duke University. So Carlos, like Chuck, is no slouch when it comes to analyzing data. And it's really important to mention that Carlos is the executive director of the Salem Center for Policy at the McCombs School. Those of you who are not University of Texas fans, which just surprises me, should know that the McCombs School is one of the finest business schools in the country. So we're privileged to have Carlos with us here today. Dr. Carvalho, thanks for making some time for this.
Thank you, Kevin. Pleasure to be here.
Yeah, thank you. And you've just come out of class. So for people who think that they're reading all the stories about higher education professors, maybe not working hard. Here it is 106 degrees in Austin, Texas today, and you are teaching the next generation of minds in America. Just came out of class to join this, so thanks a lot for doing so. Look, guys, I'm going to start with a question that's really from me. First half of this hour is going to be a series of topics that we decided we wanted to cover before switching to audience questions. But because the three of us email and talk constantly each week, the frustration that I have had, both as the director of this foundation, also as a member of Governor Abbott's advisory council to reopen Texas, about the lack of data. Here we are trying to make good decisions on behalf of all of our fellow Texans and Americans. And we, even in the state of Texas, are frustrated by the timeliness and the transparency of the data. And the reason that's important is because the data is so crucial to making good decisions. So Carlos, I just wanted to invite you first to comment on that. And then of course, Chuck, I'll ask you to comment as well, because for us here at the foundation, you've been running point on that effort. Carlos.
So I think the one thing that I would like to really, really emphasize is the fact that we don't seem to be having data at all on individual cases or the idea of exactly who is getting infected, where they're getting infected, who is getting to the hospital, who is not getting to the hospital, who is getting potentially in situations they need to be in intensive care unit, and et cetera, et cetera. So we're giving basically overall pictures that are not particularly helpful in tailoring a more specific response to the crisis that we're living. So for example, I think the media does a really bad job in getting whatever it is that's available that every day and sort of twist it into things that are just not particularly useful. Focusing on cases, for example, is something that has been very misleading from the very beginning of the pandemic. We did the patterns that we have in terms of the procedures that allow us to test in different localities are very different at different points in time. So reporting cases only is something that can be very confusing. People can be very frustrated or very scared of a situation where it's not like we have more cases, that all of a sudden you're testing more. So that's one, the sort of the more sort of obvious one, that focusing on cases is a really bad choice of given the way cases and testing procedures are changing all the time. The second part, I think, is the most important one, is that I would like to develop a more careful, for me to make a decision as an individual, I need to understand how the risk applies to me, how the risk applies to my family, and to the things that I do on a daily basis. We yet to this point, we don't have a very good understanding, or based on the data that's available here in Texas, of whether infections are happening outside or inside, or whether children are getting particularly infected or in more severe situations or not. We're trying to stitch those informations together by looking at data from all over the world, but we don't have very good reports here that allows us to make more informed decisions as individuals, not only to individuals in our family, but also to situations where is it safe to do this, is it safe to do that, and so on. I think we've learned a lot, but I think more detailed information on where things are happening, who is getting it, who is suffering in more specific ways would be incredibly useful for us to make better choices.
You hit the nail on the head right off the bat, and obviously there are a lot of really good follow-up questions that we'll pursue based on those comments. Before doing so, though, Chuck, I want to be sure that you've got an opportunity to comment on this question about the transparency of data, because this is one of your fortes as one of our senior scholars here. Also, it's something that you have been living every day since March, when I came to you and said, Chuck, my friend, could you please, at the end of every day, give us an update, a summary of the data out there? And as it turns out, it's become harder, not easier, 4 months into this.
Right. So some of the areas that I believe that Texas could do better is in both the transparency and the timeliness of the data that they're collecting. Let me give you a few examples for those of you who are watching. The first is in some states like New York, they have a division between confirmed cases and suspected cases. And in the states that are doing that, you see roughly 10 to 15% of the total cases are suspected. Texas appears to be part of the majority of states that only reports confirmed cases. And so some critics of Texas have said that our fatality rate is probably a little lower than it should be. By my estimate, it would be only about 10% lower, though, if we included suspected cases. Now, there's another aspect of this as well. And surprisingly, you saw some forward-looking leadership from Governor Jared Polis in Colorado, a Democrat, who in mid-May asked his public health team, the hospitals, to begin reporting deaths from COVID and with COVID. So in this case, if you have someone, for example, who is in the latter stages of terminal cancer, and then they also end up catching the virus and just adding insult to injury to that poor soul, in some states, that person would be reported as a COVID death. But now in Colorado, they're breaking that out between those people who are dying from the virus and those people who are dying with the virus, including presumably a positive antibody test. Now that's something that I think that we need to do in Texas. The third area, we are not getting timely demographic data on both cases and fatalities. Currently in the Texas Department of Health Services site, they're only listing about 700 plus fatalities. That's less than a quarter of our current fatality rate. And of course, if you look at that, you see, as we would expect, that the overwhelming majority of people who are dying are people who are of retirement age, not in the workforce. But we don't know how that's happening recently. That's not being updated. Lastly, the Mexican health system has completely collapsed. And there are individuals, both US nationals who live in Mexico because it's cheaper and they have family there and they work in America, as well as Mexican nationals who are coming across the border for treatment in Texas, many of them gravely ill because they couldn't get treated in Mexico. And in many cases, they're being moved north because those border hospital systems are at capacity. And so we have no information about how many people there are. Is it 5%? Is it 10%? How many of those deaths that are being attributed to Texas are really traced back to Mexico? Again, we would still be in a very difficult situation today, but potentially 10 to 15% less than we're seeing now. And lastly, as you said, it's hard to make good public policy recommendations when you don't have good up-to-date data. And that has been one of these constant frustrations that certainly I know Carlos has had as well.
I think that, thanks. Go ahead, Carlos.
Add a point to the demographic part that is very important as well, is that in places, even the places that are doing a better job in providing information on demographics, they tend to give us bivariate relationships. I'm sorry to get technical here, but the point is that they tend us to be aggregated data on, okay, here's the ages of the fatalities. Here's everybody's obsessed, of course, with race of the fatality, which I don't quite understand how much we care about that in regard to a virus. But The issue that is important is the issue of the multivariate aspect of it. I need to understand holding race and age fixed, right? What are the things that are happening here, the comorbidities and so on. We need individual data. And I understand there's issues and limitations of what we can get in terms of individual data because of HIPAA problems and so on, but a concerned effort to provide information for people can analyze and understand and separate and dissect. Is it age? Is it race? Is it high levels of blood pressure or so on, right? Those are the types of things that can be very, very informative. That right now we're just aggregating into race. Not every 70-year-old is the same. Not every Hispanic American is the same. So those are the types of things that we need to be a lot more specific about.
Yeah, and I think what happens is that even for people who are trying to be responsible, whether that's wearing a mask, keeping distance, by the way, Chuck and I are keeping the CDC recommended distance, which is 3 feet, not 6 feet, that they're looking at just this cacophony of recommendations. And you've got medical experts, you have statistical experts, you have public policy experts, all of whom seem to be giving the individual Texan or individual American competing information. And that's why there's this level of frustration. I happen to think it's one of the reasons that this has been such a summer of discontent for reasons we've covered in previous episodes of this live stream. But what we're going to do here shortly is post a slide for people. If we can do it on the live stream, we will. If not, we'll put it in the social media channels, which shows, and I know you're not going to be able to see it tuning in, but this is from the Texas Department of Health Services, looking at the breakdown, examining the breakdown of fatality rates by age. And to no surprise to either of you, you're looking at this virus being a problem for people who are 65 or 70 years of age and older. And while not being dismissive of a single death of any cause, we also know that if you look at the data here of fatality rates for people 45, 40 years of age and younger, this basically is not much of a threat. In fact, it's a much bigger threat to fight Austin traffic right now than it would be to go have this virus. So you can see this slide here. And Chuck, while it's on the screen, before we take it down, I just want you to comment on a point that both you and Carlos were making, which is that this data right here is very old.
It is very old. And by the way, one of the things that this data shows us is that it's really important to keep those who are vulnerable as safe as possible. And so people in nursing homes and your memory care facilities, these individuals are in crowded conditions, and they're very vulnerable because they're very likely to have complications and get sick and potentially pass away if they catch this virus. And so if it's the case that it's the very old who are the most vulnerable, then your public policy response is going to be very different. Perhaps it would be advisable not to shut down the economy, because what is likely going to happen is we're going to see greater follow-on effects from things like suicides and drug overdoses and people's careers and education that will end up disrupting their ability to enjoy life to the fullest for decades to come. And so it's likely that the costs that we're imposing upon society are greater than the benefits we're getting back.
Sure. And I want to emphasize that, because I know perhaps that's the first topic, the primary topic on the minds of our audience, which is the costs of shutting down again. We'll get to that in just a moment. But before we move on, Carlos, I'm just curious for you to comment, to analyze for us why getting this data is so difficult. What are the origins of this data problem that we're facing, and what might be a solution moving forward to fix it?
So I wish I could speak more clearly about the origin. I think that there is one of the great things about the US is the fact that we're now super centralized. That thing, sometimes in situations where centralization would be a little useful, bites us a little bit. And I think that's what you're seeing right now. And to some extent, we don't have a centralized system of medicine, which is great. I wish we have even more decentralized system of medicine. However, that creates difficulties and challenges in getting all the hospitals to submit the data in a way that's useful, and even the obligation of them to submit the data and release the data for somebody to coalesce and use it in a more comprehensive way is challenging. I've heard a lot of anecdotes about folks in different, whether it's Austin Public Health, whether CEOs of hospitals and so on, of just not a procedure in place to get that information together in a way that's particularly useful. On top of that, privacy issues of data is it's a problem. Again, we are obviously pro protection of privacy of people in terms of their data, and there are steps we can do in the way to allow the privacy to be maintained while using the information available. But again, that is not in place. We don't have the people in place to be able to do that. So I think the lack of individual data has a lot to do with that, the privacy issue, and how dispersed the whole system is. I wish I had a better answer to figure out how to solve this. I don't think anybody in the country has figured this out. Honestly, Chuck mentioned some places that do a little bit better job than others at some states, but I think individual data, I have not found anywhere anybody putting together information that is useful. The only place that I've seen good information on that comes out of England, comes out of the UK with the NHS. So there was a study that just got published last week that used something like 17 million records of people in the last 3 months and so on, and trying to really dissect the relative risks associated with different demographic characteristics, socioeconomic characteristics, so on and so forth. And that is something that I think is very useful, because I don't expect to be very different what's happening in the UK versus what's happening here. So that information is very useful. That is the kind of information that, again, emphasizes the fact that, yes, the most vulnerable here are the very old. There's a couple of comorbidities that are very important, primarily diabetes and high blood pressure issues. There's some other issues with immunocompromised that also seem to be very important. And clarifies the fact that kids are not at risk, that we can be sort of safe in a lot of different dimensions. But the lack of centralization is a problem. And again, we have to accept that. We have to basically know that that's the system we decide to live under, and that's a good thing.
Yeah, it is. That's well said. There's a lot of nuance in that as people who understand the importance of subsidiarity, the ability of the lowest possible unit down to the individual making as many decisions as they can. We appreciate that. And yet, Chuck, for those of us who take pride in waking up each day in Texas, specifically America broadly, we're still frustrated. And so I'm curious, based on your time in California, the great bureaucracy that it is, if you've got any inklings as someone who's been an elected official, you've spent a lot of time studying government databases, the origins of the lack of data, and perhaps more importantly, how we might be able to solve this in Texas specifically moving forward.
Yeah, I think that some of what you may be seeing in Texas goes to what Carlos was saying about centralization versus decentralization. Texas has a lot of counties. We have a famously weak executive compared to other states.
Constitutionally.
Constitutionally, yeah. Right? It was by design. And so while on the good end of things, Governor Abbott and Dr. Zerwas, his point person, added some 89% of hospital capacity, I think it was ICU capacity, from early March until the first part of June, to prepare for any potential surge. And so that's very laudable, and that's on the good side. On the difficult side is we're seeing the counties kind of reporting data whenever they feel like it. There doesn't seem to be a consistent standard. We're having a terrible time getting confirmed information about demographics as to who has been catching the virus and who's dying from the virus. And we have no clue about the international aspects of this. I know that one of the problems in California, for example, is you've been seeing very similar things happen in California, Arizona, and Texas, with people coming across the border from Mexico because the healthcare system there has collapsed. In California, you have a large number of retired expats who live in these condominiums down on the coast of Baja, probably a couple 100,000 of them. And they're getting sick, and because they're older, they're at risk. And what happens is when they come into California, the receiving county will log them as a case. And then because their healthcare systems are at saturation on the border, they move them north, and then the receiving county up north logs them as a case. And so we're getting some double entries into the system because it's really not designed for that sort of mobility. That may be happening a bit in Texas because the border counties are being hit to capacity, and they're transferring. By the way, that's routine. That happened during Hurricane Harvey out of Houston. This is not abnormal. This is what our flexible hospital system does. Our administrators, the doctors, the nurses, they're incredible people, and they're doing amazing work right now. So transferring people between regions is completely normal, even in regular times.
Probably good.
And so we're seeing that now. It's just that the data probably isn't accounting for that.
Right.
I would add, so the one point to that I think is also important, people will take multiple tests while they're sick. They might take the first test and the second test and the third test. And I could not find an answer to whether those things are reported. And so that's one case, right? And it gets to be reported sometimes three times. And that's again, I don't know to what extent that's a problem, but it's definitely something that I could not get a good answer for. And to the point of centralization, one of the things that I think counties could do, should be doing, and cities should be doing, and I don't think the state necessarily is a place that should be responsible for this, is that, in the very beginning when we got into a lockdown, there was this whole notion of we need to start working on contact tracing, some notion of understanding when you get it, who got it, who's in contact with you, and understand the progression of the cases. That seems to be a complete wasted effort all over the state. I don't see that taking place in any good county. They say that they hire people and so on, but again, that would provide us information of where things are happening. Is it happening at the grocery store? Is it happening at the protest? Is it happening where is it? Where are the things that we should be trying to constrain in order to, slow down the progression? And that information.
Carlos, we've been told they don't happen at the protests.
Oh yeah, that's right.
So just move to revise and extend the remarks.
Yeah, that is we're trying to use humor to point out the absurdity of some of the aspects of this, but you're making a good point there, Carlos, about contact tracing. And there's no one in this state, I would like to think, is more concerned about the potential for violating privacy with something like contact tracing. But there are examples of governments around the world that completely protect privacy, make this totally voluntary, and it is a very important tool during a public health crisis. So I know that's a concern of many people tuning in, and perhaps we'll see that question pop up in Q&A. Before we get to audience questions in a few moments, though, I'm just curious to ask the two of you about a couple of specific situations. One of them is what to do with schools. In fact, Carlos, I know in your case with the work that you've been doing, you've really been homing in on the importance of opening schools in person, showing the data that, as we've discussed already, that proves this is not a concern for young people, perhaps even in transmitting the virus to someone who's more vulnerable. We'd just like the two of you to cover that topic, the importance of opening in person as soon as we can our schools.
So let me start by just pointing out the fact that one of the things that frustrated me the most throughout this last 4 months is the inability that public officials have to talk about trade-offs. So, again, when you're thinking about whether to open schools or not, you cannot just think about unilaterally about, the safety of your kids or the safety of teachers. You have to be thinking about the big picture, and all the other things are consequences associated with that, right? So opening schools, on the one hand, offers potentially a risk associated with the fact that, there's added risk for the kids. If your kids are at home, they have a lower chance of catching the virus. If they go to school, they're going to have a higher chance of catching the virus. But at the same time, if they stay home, well, there's lots of problems that we know associated with that. They're not learning. They're not developing. They might be getting, can I start to list the number of problems that we have in not opening schools? And when you look at the question of risk, the risk, I think, is now overwhelming the information that we have that the risk for kids is very, very low. So the kids are not at risk. The kids going to school, my kids today, I have one in camp and one in daycare. So I'm not just saying this, I'm living this. My kids are out there and because there's low risk. Every day they get out of the house, they have some degree of risk they face. The added risk associated with COVID is minuscule. So that's not a concern. The second concern that people have is a concern of, well, how about the teachers? The teachers might be at risk. Well, that's true. The teachers are more at risk than the kids are, but it's much easier to mitigate that risk for the teachers than it is for the kids. So for example, teachers that are, let's say, 65 or older, who should be able to find a way to mitigate their risk and maybe let them teach online. They might not, I think voluntarily even saying that if you don't feel comfortable being in a classroom with kids, sure, maybe you stay at home. But a 35-year-old, that's not really a reason for that to take place. So again, trying to be more specific about who is at risk in that environment. And the third aspect of it, and I think you're going to hear that from epidemiologists, is that, well, the transmission aspect, kids at the schools being open is going to lead to an explosion of the disease out there. First of all, I think we should stop with the notion of explosion of the disease. That just doesn't happen. We haven't seen hospitals getting overwhelmed anywhere in the world. We have been living this for now 4 months. So things get tough, things get stressed. But nowhere in the world we saw the numbers that the new Fergusons of the world were predicting in the very beginning of this pandemic. So let's stop with that. Let's stop with that discussion because it's not useful. So yes, the kids being out there might lead to an increased degree of transmission in society. But again, we have information that kids seem to be very low probability transmitters out there. That doesn't seem to happen as often as adults do. So combining the fact that they're not at risk, they're not seem to be vectors of transmission that are very high, and the fact that the costs of keeping them home are incredible. The costs of keeping them home are costs not only to the kids, are costing to our parents that work, are costing to our society, to our labor markets, to the future participation of women in the labor force. The number of women that are dropping out of the labor force because they have to stay home with their kids is mind-boggling right now. The effects of this are long-lasting, and again, the trade-off is just like, yes, accepting a little extra degree of risk is tolerable given the alternative here.
Yeah, well said. Chuck, what would you add?
Well, it's really hard to add anything to the good doctor's comprehensive review. I would just say that if you look at the annual influenza, influenza generally, from what I've seen, has higher mortality rates for the very young than does this variety of COVID. And certainly there is a vaccination for it if they get it right. Seems like every 3 or 5 years or so they miscalculate, and the shot has only modest effect. But for kids, infants and school-age kids die in greater numbers from the flu than they are from COVID. And so then you go to the economic consequences that Carlos mentioned. They are truly devastating, and you're likely going to see families that are going to be recovering for years after this from an economic standpoint.
I want to pick up with that and swerve into an aspect of this entire pandemic that I find very frustrating, even though we recognize that, as Aristotle would remind us, we're political animals. We exist in the public square, even if we don't want to. And the point is this pandemic has been politicized. That's not a surprise. What's been a surprise even to me is the extent to which it's been politicized and the way that's playing out here in Texas. And it's relevant for audience members not from Texas, because as Texas goes on this virus, as Florida goes on this virus, the country's likely to go, meaning the response. And so we've got to get it right here, the government response. But there's tremendous pressure on our governor by the mayor of Austin, by now, as of last night, the mayor of Houston, to shut down again. And here at the Texas Public Policy Foundation, we believe that would be cataclysmic in its consequences. We just have social activity resuming. We just have economic activity resuming. And both of those, along with many other things, are very important to human flourishing. Before we take our first audience questions, I just want to give each of you the opportunity to lay out for our audience members how extensive a problem it would be if our elected officials in Florida and Texas cave to that pressure to shut down again. Chuck?
Well, certainly from an economic and social standpoint, it would be devastating. Very difficult to calculate the costs right now. But the sad thing is, of course, 5 or 10 years from now, we would, and we'd be wondering, why did we do this? I think it's very important to understand that our hospital system is very resilient and very flexible. As I went through before our broadcast and looked at the different regional systems, generally speaking, you see general hospital beds occupied at about 40 to 60%. And of that, roughly half of those or less are occupied by COVID positive patients. And then if you look at the ICU beds, which is very, very important, you'll find that the utilization is very high, as it usually is, because they're expensive to operate. You don't want to have a vacant ICU bed. But what you find is that the COVID percentage of those ICU beds is generally in the 20 to 30, 35% range. It is trending up in certain regions, but the hospitals are very good about scheduling or rescheduling elective surgeries to make room for those. And by the way, that's not even counting the enormous amount of surge capacity that was put in place by Governor Abbott and Dr. Zerwas ahead of time to be prudent. And I haven't yet seen any region, I may be wrong, but I just looked at it recently. I haven't seen any region that has yet had to dip into that sustainable surge capacity for ICU. And that's not even counting the unsustainable surge capacity that they put in on top of that. And so we are a long ways away from overwhelming our system, even though it is getting busier. Two more interesting points. Dr. Carvalho has seen, and I've validated this myself, that you're seeing a younger cadre of people in our hospitals. And because our treatments are improving and because they're generally younger, you see a better cycling of people going in and out. They recover more quickly and they're getting out. You do see a gradual accumulation of ICU patients, probably older individuals. One last very important point. If you look at the number of people who have recovered from the virus versus the new cases versus the people who have become fatalities, for about the last week, we have had as many people recover as we've had new cases and fatalities. That wasn't the case for about 11 days in a row prior to that. We were seeing this big increase in new cases without a corresponding number of people who were rolling off and becoming recovered. This would suggest that we should be able to handle this. And maybe, hopefully, we're getting near the peak and things will start to improve.
Good. Carlos?
Yeah, I just add that one of the things that have been misunderstood out there is that what is the goal of a shutdown? Right. So the idea that a shutdown solves this crisis is false. A shutdown just pushes infections to the future. So the only thing that's potentially justifiable on which personally, I think that's something that government should not have the ability to do. It's just too extreme of an act with too many unintended consequences that are just unmeasurable, and therefore the medicine might be much worse than the cure than the problem here, right? But the only potential justification that I can see is the fact that overwhelming hospitals. That's okay. If hospitals are in the brink of being overwhelmed, perhaps if you're able to slow transmission down by implementing a lockdown, that could be a useful thing for that particular target of not overwhelming hospitals. And as Chuck pointed out, I think that things are stressed in the hospitals now. But overwhelming to a point of needing that is just not even close to me in my assessment. I think that if you look at the 3/4 of patients that go in the hospital for COVID, they're there for liquids. They're there for observation. They don't do anything. It's a virus, right? There's only one way for you to recover. It's your body to fight it off. That's it. So what you need to do is give you time to fight it off. And some people need extreme interventions to fight it off, and those are the people in ICU beds and ventilators and so on. But the portion of that is small relative to the majority of people that are just in observations, just in transition type of mode, and that can be done into field hospitals. We should, when Houston took down the hospital from NRG, that was a mistake. Right? We had this thing built, and there was no reason to disassemble it, knowing that as we open up, we expected cases to surge. It's natural. We have to go through this. It's a natural progression of the virus. And I think that that's the type of thing that I would like to see happening from our officials, is to invest on surge capacity, build it up, sort of like a wartime effort if this is needed, but not asking us to be in house arrest again.
Well, that's well said. And I think the other thing that would emphasize is that it would or produce is undermine the intentional fear mongering that's going on in some circles. And that fear mongering is resulting in some decisions about hospital capacity, preventing people who really do need care. They need diagnostic tests. They need cures to the problems they're facing medically, and they're not able to have them. And that's the point that I think the two of you are making that's so crucial about shutting down again, that we do have to recognize we are going to live with this virus we have for 4 months. We hate the fact that people have died from it. We hate the fact that they get sick from it, but people have died and gotten sick from many other things during the same time. So the first question from our audience will be, I think maybe the last question about data, because I think the two of you have just done an exceptional job of explaining that. But we love giving our audience members a sense of practical steps that they can take. And so one audience member is asking, is there a reliable source where we, the public, can access up-to-date data concerning positive tests and deaths? So Chuck, is there one spot where our audience can...
Well, I almost hate to recommend them, but in this case, they're actually practicing journalism, which is what they're supposed to be doing.
Oh, this is going to be a doozy.
Yeah, the New York Times has a very good interactive site where they look at all the states, and you can call up a map where it shows the hotspots by county. They look at positive tests, they look at fatalities, and they generally get the data, and this is the frustrating part, 12 to 24 hours ahead of the Texas State Department of Health Services site. So they are actually going out and pulling data from the counties in a more aggressive fashion than the state bureaucracy is. And so I generally look at them first thing in the morning because it gives me a good idea as to how many new tests have been conducted, how many new cases. And then, of course, I do look at the Texas site. I look at the Johns Hopkins site. More times a day than I would care to admit.
Sure. Carlos, anything you would add to that?
There's I've been, one of the things that's been incredibly useful in this crisis is Twitter. It's incredible how much better they are in reporting some interesting situations than the news are. So yes, there's lots of websites out there. I think Chuck covered them. I think Worldometer is another one that I think it does a good job in presenting the data, has some plots, and you can look at countries and states and counties and so on.
Would you give us that website?
It's Worldometer, I think. Okay. Is the if you just Google
Worldometer.
Okay. Yes.
Sounds like an Irish site.
I was just about to say.
Yeah, I don't know exactly where. It's been from the very beginning. They start compiling data in an interesting way. It's full of ads. It's annoying, but it's useful.
Yeah. Okay.
And
well, there's some commercial activity going on.
Exactly, and exactly, it's good. But there's a number of people, and if you want to find a person on Twitter that will link you to a lot of interesting information, is Aaron Jin. That I think that's how he says his last name. I'm not sure if I'm right. But Aaron is one of our Texan friends that has been doing a phenomenal job in putting a lot of information together. And through his people, there's a lot of people that follow him on Twitter. And I think through there, you get a lot of interesting information. It's not the same type of every day, the same type of plots, but I think there's a lot of interesting, important information being provided in that discussion.
Those are good tips, and Aaron is doing great work. In fact, he was supposed to join the two of you as one of our guests today, but is busy with one of those data projects. So we hope to have him back, and obviously the two of you whenever time allows. So let's move from one easy topic, which is the lack of transparency of data, to another easy topic, which is about mandatory mask orders. Another audience member asks, with all the conflicting information about masks indicating they're not as effective as believed, why the push to mandate their use? Carlos, we'll start with you.
Okay, so that's the if I put my libertarian hat versus my non-libertarian, my professor hat here, I have some conflicting thoughts on this. The information is not conclusive. So I think that there were different studies from different people. But here's one thing that we know: it doesn't hurt. Okay, so that's one thing, and
just the act of wearing the mask.
Yeah, just the act of wearing the mask. Like it's an annoying thing. It's not pleasant. It's not like interactions with people with a mask is not right. Life changes right with that, and that's not great. I would equate wearing a mask to speed limits. I hate speed limits. I hate the fact that the government has to tell me that don't go faster than this. I know what's best for me driving my car. I know what's, and I try to be, because me getting an accident with somebody else is a problem. But again, we accept that, we tolerate that because, some people make stupid choices out there and so on. So it's not great, but it's something that we have to live with. I think the masks, there's also a demonstration of some sort of, we're working on this type thing. Together. I think that there's a social aspect of it that I think it's potentially beneficial. But I cannot say to you for sure that, oh yeah, this definitely slows down by a certain amount and so on. I think there's some studies that will show that slows it down, that protects you're not protecting yourself. Let's be very clear. The wearing the mask is very, very small in protecting yourself. It's just like avoiding you, if you, for some reason you are asymptomatic and has the disease, it's just slowing down the process of you putting out particles out there that potentially will infect others. That is the degree. Now, I find that one interesting data point that it's a mystery to me, how Japan has been able to handle this pandemic in ways that no lockdowns, very small, mild decisions on avoiding crowds and so on. But they have a cultural norm of wearing masks all the time. If you ever visit Tokyo, you know that on a regular day, people wear masks, right? Because of pollution, because of other things as well. And I think that, that might have played a big, important role in slowing down the progression in Japan. And again, this is speculation on my part, but I think when I look at that, I do think that it's something that it's a small price, especially at the moment that we're living right now. It's a small price to pay relative to the alternatives that governments are threatening us with. Government is threatening us with something much more draconian. So I would say that, yeah, for now, let's wear a mask.
Thanks, Carlos. Chuck, why don't you speak to the mandatory nature of that? I think that's an aspect of this the audience member's curious about.
Yeah, so it's always difficult in practice, especially with public health, and rectifying that with our love of liberty that's rooted in our foundation, both in the Declaration of Independence and in the Constitution. You saw this as public health began to emerge as a kind of as a thing, as an adjunct to government over 100 years ago, where when people came down with tuberculosis or other highly contagious diseases, they were quarantined in their house. There was a sign put on the house, and there were very tough criminal sanctions if you were to violate that. Now, of course, that's targeted on people who actually are contagious, not on everybody. But nevertheless, there's that tension between keeping the general public safe who didn't sign up to catch your illness and infringing upon the liberties of someone who certainly didn't commit a crime, but they're contagious. Now, regarding masks, the consequences of these sorts of edicts are not without, they're not without impact on certain people. So, for example, numerous studies have shown that people's blood oxygen begins to drop if they're wearing a mask for a while. And if you have an issue, perhaps it's the quality of the mask, perhaps you yourself have a difficulty keeping good blood saturation. You become dizzy. You don't want to be out in public. I know the other day I was at a Home Depot needing to get projects for a landscape project that I was working on. And I was overcome outside wearing my mask. I couldn't breathe. I was starting to gag. And I'm thinking, great, if I take off the dang mask to try to not pass out, am I going to get a big fine, right? And I just needed to, I couldn't stand it. I had to recover. And I'm used to military mission-oriented protective posture, right? The full protective mask and the charcoal-activated clothing and everything else, at least back when I was in my prime as a active Army officer.
There may be a comment, my friend, about age.
Yes, there could be a comment about age if you were unkind.
That's right.
Yes.
That's right.
So the point, though, is that this is then going to impact commerce, right? Because I became less likely to leave my house at that point because it is so uncomfortable for me to wear a mask in certain settings because I have difficulty getting breath. Maybe I just need to get a mask that really doesn't actually work.
Right.
And that way I can check the box and I can still breathe.
Right. So what we may be seeing here, and I think to sort of write the headline, putting your two excellent responses together, is this becomes a social or cultural norm that's a decision on us, fine. But obviously there are some unintended consequences, maybe some intended consequences, depending on the elected official issuing the edict. So we appreciate that question from the audience. We'll ask one more question about sort of the government response to the pandemic, and then we have some specific policy questions, particularly in the realm of education. So both of you are well equipped to answer those. But this last question about the testing regimen is, what can the state of Texas do to standardize the testing so that the reporting will be more accurate and reliable? I know both of you have spent a lot of time dealing with that question. Chuck.
Well, I think that part of what needs to be done, as Carlos highlighted earlier, is what happens, how is one individual getting multiple tests, how is that handled? The other thing I'd like to see is I'd like to see the state do more with the antibody testing that they've done so far. Every day, we see between 2,000 and 5,000 antibody tests get posted to the Texas site. Now, those are not counted insofar as active cases, or I think even recovered. I haven't seen any evidence that they are, but they are reported as how many they've done. Well, let's have some professors, some public health officials dig into that data and see if we can figure out whether or not the total number of Texans who've been exposed to the virus and perhaps didn't know it, is it double our current known infections? Is it 10 times? Is it 20 times? Are we getting closer to herd immunity? That's the sort of question that we can find out. There were some fascinating studies that have been done, not in Texas, but around the country and around the world, that show that in the early stages of this pandemic, in places like New York, that 80 times the people that they thought had been infected were in fact infected. And that today you may be looking at 10 to 20 times the number. Well, if it's 10 times, we're looking at somewhere on the order of what, 2.5 million Texans that have been exposed to the virus, 90% of whom likely thought it was just cedar fever or maybe nothing at all.
And
Carlos?
with antibody tests, the one thing that's more even very important is the fact that people that have had the studies now they're showing that people that have a small reaction to the virus might actually not develop antibodies. So their T cell systems were enough to fight it off. So one of the things we're learning is that the antibody testing is going to even tell us that a lower percentage of people are at least temporarily immune to the virus. So that would be useful for us to understand the progression. And the other thing, honestly, is actually random testing would be incredibly useful if we had a better understanding of the actual because think about the selection procedure of before people go to tests, right? If you already have to feel sick before you go in, given that we don't know exactly the percentage of people that have the virus that feel sick enough to go get a test, right? We just don't know the extent to which this virus is out there. So I think if we had the ability to, voluntarily random testing on a daily basis would give us a very good information that we would learn more specifically about the infectious fatality rate, which right now we what you showed earlier was case fatality rate, which are much inflated numbers relative to the actual risk that people are facing, given that the number of people that might have gotten the virus is just much larger than what we are able to compute. So yeah, I would encourage the governor and the public officials across. I tried this at least in the city of Austin, say, let's do this. Let's do random testing. Let's do random testing, especially when back in the time when they were doing, they're trying to shut down construction. They're trying to shut down more things that they already shut down, right? I was trying to encourage people to say, let's go random test at the grocery store. Is the grocery store that dangerous? Are those people really exposed? Let's see how often do I get a positive test at random showing up at a grocery store and so on. But very little luck on getting officials to go on that direction.
Yeah, and that would have, and if for some reason it's implemented, would go a long way to identifying those aspects of daily life that are perfectly normal. And most of them are perfectly normal, meaning that they're just not sources of great threat of the virus. I think that's crucial for us moving forward, especially as we're going to see the politicization of this virus persist, I would guess, until the day after Election Day. So before we go down that rabbit trail, although it's extremely tempting, what we'll do instead is cover some policy questions about education. And Carlos, I presume that you came out of class, which you were teaching virtually. So what a great timely question for you from one of our audience members who asks, what long-term changes might we see to traditional education as a result of COVID?
So I'll start by talking about higher ed, where that's the business that I'm in, right? I think that's just it's cliche to say this, but it's just going to accelerate some trends that we're already seeing. I think that there's a lot of pressure and understanding that we can, augment our presence, have more impact on a larger number of students, and so on through technology, right? And this sort of just like hit in our faces and say, hey, go do it. So everybody starting March 3rd, right, had to figure out how to teach online, and it turns out wasn't that bad. Now, can it be improved? Of course, it can be improved. Is technology completely ready for it? Absolutely not. But it can be done. It can be done. And I think it's going to, make it very hard for places like UT to go to the legislature session and say, yeah, we can only manage 40,000 students. Like, I don't agree with that statement. And, I'm sorry, some people in my university would disagree with me strongly on this, but I think we can manage more and we should manage more. I think we have an obligation to try to reach more Texans. And I think technology might help us in that direction. Now, that said, there's definitely some shortcomings of that. I think there's some interactions that are definitely missing by using technology. And I think that is going to be particularly important with little kids, like smaller kids. And my experience, at least seeing what my son had to go through by doing things online, it's just not the same. I think that I don't see the impact on that, this trends in lower and K through 12. I think that's going to be more focus on higher ed.
Yeah, I appreciate those comments about higher ed. And Chuck, a related question, which is going to emphasize K through 12. One of our audience members asks, how are we going to handle what this audience member is presuming will be a teacher shortage as a result of this? And I can only presume, I don't know, but I'll add to that wonderful question from an audience member. We've seen teachers unions in Texas, every state, nationally, talk about what they see as the folly of opening in person. And presumably this audience member is thinking about that and worried about even having available teachers.
Right. Well, that's, I think, a good worry. Certainly the state could go a long way by waiving certain certifications and requirements. I know that in the case of my own wife, she had a permanent credential to teach both music K through 12 and general topics K through 6 in both New York and in California, but Texas doesn't recognize any reciprocity. And so she looked into getting her certification here and was dismayed to see that as a music teacher of a few decades, that it's essentially would have required her to go back to school. And so she said, to heck with it, it's just not worth the effort.
There's a lesson in there about bureaucracy too.
There is, as well as how these things are created as kind of a way of limiting the market to keep competition down. And so if we were to waive certain rules because of the pandemic, because of this emergency, and allow people like my wife to have the opportunity to come in and teach again, it seems to me that we could probably increase the supply of teachers to what was needed.
Sure. So, I might add on to that excellent response. I think that's a lot of saber rattling by teachers unions. And here, at least at the Texas Public Policy Foundation, speaking for those of us who are here, we'll let Carlos speak for himself. Those would not necessarily be organizations that we would associate with telling the truth often. So we might dispel the fear mongering there. So, gentlemen, last question for you is a question we ask all of our guests, which is, in spite of everything that we're facing, and we have a lot of reasons if we wanted to be pessimists to be pessimistic. In spite of all of that, what will you encourage our audience members to do practically to help out, to sort of wake up each day and know that they're participating in solutions? In other words, what kind of encouragement will you give the people who have tuned in? Good doctor, we'll start with you.
So let me start by offering, I think, what is a optimistic view of what we are in Texas relative to this pandemic overall. You see now a lot of places in the country where cases and deaths are gone, essentially gone. Okay, and there's the explanation of one of the potential explanation of this is immunity took hold in those places, and the chain of transmission is broken. And those are the states that had a very high mortality rate. So we're talking about New Jersey, New York, Connecticut, Massachusetts, Pennsylvania, Michigan, and Illinois, places that had pretty bad. They got it pretty bad. So just a number to be put in perspective, New Jersey had 1,700 deaths per million, and we had about 110 so far here. It's an enormous disparity, right? So I think the optimism says that, listen, we might be able to navigate through this in a way that we're never going to get that bad. But there's hope that this thing's going to slow down. I think that's states like Florida, Arizona, Texas, and California to some extent, we just didn't have enough people sick yet. And if the young are getting sick, that's actually might be a good thing. That if we're able to effectively protect the vulnerable and old, we're going to be able to get out of this with, we're going to reach the degree of immunity that's needed with a much lower death rate. And I think what we can encourage people to do is my strong belief here is that, yes, avoid large gatherings if you can, but live your life. Live your life. Don't do the minimal things that are useful and is smart about protecting you from a respiratory virus, but don't think that you need to be locking down in place at this point in time. Have your kids be out there. Don't let your kids suffer the unwise consequence of these lockdowns. And if you do have folks that are more vulnerable, that are unhealthy or are older, yes, protect them. Protect them. Like, my mother hasn't been out of her house in Brazil in 100 days. And it's sad. It's very sad. There's isolation that takes place associated with it. But, she's 80 and very vulnerable. So I think that's what I would encourage everybody to do, is be specific and be careful with the people that need to be careful. But our lives have to go on. There's no solution to this problem. The world got a little bit more dangerous, but it's a little bit more dangerous. It's something that we can absolutely manage.
Thank you for that. Chuck?
Well, I would just encourage people to be mindful of the fact that, for example, the restaurant industry has been devastated, and a lot of people in retail have been put out of work. And so, be as kind and mindful as possible. Perhaps if you have the ability, give a little bit of an extra tip when you go to pick up the food. Be as friendly and forgiving as possible. People's nerves are often frayed, and we just don't need to add to that. This too shall pass. We will get through this. And it would be my hope that as Americans and as Texans, that we'll come out of this perhaps with a little better sense of community than we had prior to that. That's my sincere hope. And we need to get back to work, and we need to get back to the business of business.
That's well said. You know, for those of us, and I know I can speak for you and for me, who consider ourselves conservative, we mean that in a very long-term kind of way, which is not merely limited government, which is a really good goal. It's not merely liberty, which is a really good goal. It starts in community. And I think that's the lesson that we need to remember. And that's actually one of the reasons we abhor all of these mandatory orders to do this or that from any government. It's not even the mandatory nature of itself. It's that what that does is undermine our human relationships with one another. So I would add a couple of things to your excellent responses. The first is a very practical thing. And of course, one of my obligations is to promote the Texas Public Policy Foundation. But there's a real specific thing you can do if you've been, like I have been, and I know Chuck and Carlos have been, frustrated certain days, sort of getting to that spot of frayed nerves. And that's sign up for our daily canon. It's a daily newsletter that you can find at texaspolicy.com. And what we started doing a few weeks ago to address that frustration was to put a couple pieces of data that keeps this chaotic year known as 2020 in perspective. And so I think perspective is a really important thing to do or to have during that. So texaspolicy.com, sign up for the daily canon. The second thing is a message I would have for all of our elected officials, regardless of party. And we as individuals can aid them in this goal that I'm going to mention by being encouraging about good decisions and in a polite and firm way, discouraging them from bad decisions. And it reminds me of something I mentioned in our July 4th episode, which was this wonderful speech by a non-American, Alexander Solzhenitsyn, who in 1978 at Harvard, and what I think is one of the greatest speeches in human history, said that the crisis that the West is facing, that Western civilization is facing, is a crisis of civic courage. For elected officials and people who have their ears, now is the time for civic courage. Now is not the time to be shutting down. Now is not the time to be talking about going backwards. Now is the time to stand up and say what Chuck and Carlos have said for an hour, which is that we're ready to live again. Let us do that. Let us make our own decisions. And please aid us in doing so by giving us the data you, as elected officials, have a moral obligation to provide. That is the line that the Texas Public Policy Foundation is drawing in the sand. And I can't thank you two good friends enough, Carlos Carvalho, Chuck DeVore, for joining me today and helping to make that message. For those of you in the audience, thanks for spending another hour with us. We will, of course, be back next week. Take care and God bless you in the meantime.